Does your dog not stop scratching? Does he lick his paws constantly? Are your ears always red? Or do you notice that his allergies return every few months? Even if you change food or put creams on it, because I want you to hear this. A dog should not live with constant itching. And the problem is that many owners believe it's sensitive skin. It's normal in this breed, or is it simply a mild allergy? But many times behind from that itching, there is a disease chronic inflammatory ad, which can destroy your dog's skin for years, canine atopic dermatitis. And here comes the most important thing, does not heal completely. But today, thanks to new treatments, scientific advances, and discoveries entities, we can control it a lot better than a few years ago. So let's talk what atopic dermatitis really is, why it happens, how to recognize it at home, which breeds present the most risk. What are the most modern treatments in 2026, and what errors make the problem much worse? Stay until the end, because there is a very specific sign in the legs and ears, which many owners ignore it for months. And it is usually one of the first clues of atopic allergy. Hello, I am a veterinarian, and today we are going to talk about one of the disease's most common skin problems in dogs, canine atopic dermatitis. And no, it is not rare. According to recent studies published in Frontiers in Veterinary Science and reviews of the International Committee on Allergic Diseases of Animals, in its acronym ICADA, between 10 and 15% of dogs suffer from atopic dermatitis, and these data are from 2023. The number continues to increase. Besides, studies from 2024 and 2025 relate the increase of allergies with environmental changes, pollution, microbiome alteration, skin, and genetic predisposition. That is, it is not just an allergy, it is a complete immunological disease. Atopic dermatitis is a chronic inflammatory disease of the skin. Point. Well, let's give you more details. The dog's immune system overreacts to normal substances in the environment. For example, dust mites, pollens, molds, weeds, even environmental particles inside the house. Anything goes. And here comes something very important. What we know today, thanks to research recent. Many atopic dogs have altered skin barrier. That is, the skin itself does not protect well. Studies published in Veterinary Dermatology muestran that the skin loses water more easily and lets in allergens, bacteria, and yeast much more easily. That's why the skin becomes inflamed, itching appears, and symptoms begin constant secondary infections. The more his scratch, the worse the problem becomes. It's a vicious circle. Okay, at this point, this is where I want that you pay a lot of attention, because the star symptom is itching, of course, but not just any itch. The most typical areas are paws, ears, armpits, stomach, groin, snout, and around the eyes. Sometimes one or two of these parts and others all together. More frequent serials, such as the constant amido legs, head shaking, repeated otitis, scratching or continuous red skin, bad smell, hair loss, scabs, and darkening of the skin. They are the most frequent signs, and here comes one of the most important clues. Many atopic dogs start alone with recurrent otitis, no visible lesions at first. This is described in multiple recent clinical reviews. In secondary problems, infections, inflamed skin loses protein secretion, and then they appear bacteria and yeasts such as Malassezia. Result, more itching, more smell, more inflammation, and the dog enters in a terrible loop. Let me ask you something. Does your dog lick his paws constantly? Does your dog have recurrent otitis? Write it to me in the comments. And if this video is helping you, like and subscribe to Vet Story. Diagnosis. There is a lot of confusion here. There is no single magic test that detects Atopy. The diagnosis is based on symptoms, lesion distribution, a clinical history, and rule out other diseases 80s. First, we have to exclude fleas, scabies, that is, external parasites. Do you have a link to a video on the topic up here? Infections and food allergies, and be careful with this, allergy tests do not diagnose the disease. They serve mostly to prepare personalized immunotherapy. This is emphasized by the most recent ICADA guidelines. This is where veterinary medicine has advanced the most. And I want to make something clear, there is no definitive cure for most of cases, but there are very effective treatments to control the disease. Itching control. Today, the most used treatments, these include oclacitinib, which blocks itch signals very quickly, locavetmab, an injectable monoclonal antibody, and this is important. Recent studies show a very good profile long-term security, especially useful for older dogs. Repair the skin barrier. This is key in 26. We no longer treat just the itch. Now we know that must be hydrated and repaired, the skin changing its evolution greatly. That is why specific shampoos are used, essential fatty acids, ceramides, and skin hydration. Immunotherapy, the most interesting part, Because here comes the new thing. Allergen immunotherapy is the closest thing to modify the disease. It consists in teaching the immune system IO to tolerate allergens, and recent studies continue to show symptom reduction, less need for medication, and better long-term control. Although it takes months to take effect. And this is important for the owner to know beforehand. Very common mistakes. Constantly changing food without diagnosis. Use human creams. Bathe him with aggressive products. Thinking will pass, and leave infections untreated. And the worst of all, the worst by far, is to normalize the itch. A dog should not scratch constantly. And remember, it's not just incessant scratching, but sometimes an obsessive licking too. I want you to keep this. Atopic dermatitis is not just sensitive skin. It is a chronic inflammatory disease, and the earlier it is detected, the better quality of life your dog will have. Because living with constant itching is living with stress, inflammation, and discomfort every day. If this video has helped you, like and subscribe. And tell me in comments, does your dog have any of these symptoms? Red legs, perhaps? Has your dog suffered from otitis, or does he suffer from it frequently? Do your dog's paws itch or something? Maybe he's licking them too much? Why have these signs? It can completely change your dog's life. Thank you very much for watching, and see you soon.